Welcome to this physical assessment review for licensed nurses, prepared by Joy Koniski, RN-BSN, Director of Staff Development at Royal Springs Healthcare and Rehab. This video will help you ensure resident safety by identifying early signs of deterioration and establishing accurate baseline data for new admissions. It will also enhance your clinical judgment and assist in meeting regulatory standards through accurate documentation. A comprehensive head-to-toe assessment is required upon admission, at the start of each nursing shift, or whenever a change in the patient's condition is clinically indicated. Any unusual findings or change of condition must be immediately addressed with a focused assessment. Foundational assessment includes patient advocacy, active listening, and protecting privacy. The primary assessment uses the ABCCS framework: airway, breathing, circulation, consciousness, and safety. Remember, the ABCCS check is a rapid priority, especially in an emergency. The first step in assessment is evaluating the patient's general appearance, noting their affect, level of hygiene, body position, mobility, any remnants of injury, and their speech pattern and articulation. When assessing skin, hair, and nails, inspect for lesions, bruising, rashes, pressure areas, and edema. Palpate the skin for temperature, moisture, and texture. Inspect the nails for consistency, color, and capillary refill. Reviewing common skin rashes is essential, including recognizing a pustule, scales, fissure, erythema, scar, vitiligo, eczema, cyanosis, papules, ulcer, tumor, and necrosis. Redness over pressure areas like heels, elbows, and hips signals the need to reassess the patient's need for repositioning to prevent pressure sores. When assessing edema, unilateral swelling often indicates a local issue like DVT. Bilateral pitting edema usually suggests a systemic cause, such as cardiac or renal failure. Always check unilateral edema for signs like tenderness or warmth. Pitting edema is graded on a scale from 0, no pitting, to 4+, severe pitting. This classification helps document the severity of fluid retention. The nurse should always clearly communicate with the patient about the assessment steps being performed, such as checking their eyes, while maintaining a professional and reassuring demeanor. For the eye examination, inspect for any drainage, which can indicate infection or injury. Inspecting pupillary reaction to light is crucial, as unequal reactions may signal neurological impairment or medication effects. When examining the mouth, tongue, and teeth, assess for moisture and color. Dryness indicates dehydration. Check for ulcerations or patches, which may signal infection, and ensure dentures fit properly to prevent pain and aspiration risk. The chest examination involves inspection, palpation, percussion, and auscultation, or IPPA. During inspection, look for chest wall expansion, use of accessory muscles, and jugular distension. Jugular distension can suggest cardiac failure. Auscultate breath sounds both anteriorly and posteriorly. The presence of crackles or wheezing is an unusual finding and requires further assessment, documentation, and reporting. Follow up with a focused respiratory assessment. When palpating the chest, check for tenderness, tactile fremitus, and symmetry of chest wall movement. Also check for crepitus, tracheal position deviation, and diaphragmatic excursion. For the gastrointestinal system, track bowel movements. Inspect the abdomen for distension. Auscultate all 4 quadrants for bowel sounds, documenting if they are hyperactive or hypoactive. Use light palpation to check for tenderness or distension. For the genitourinary system, check urine output for changes in frequency, color, and odor. Dark or foul-smelling urine indicates dehydration or a UTI. In the elderly, UTIs may present as acute confusion. Abdominal distension may indicate ascites associated with conditions like heart failure or cirrhosis. Markedly visible peristalsis with distension may suggest intestinal obstruction. Measure abdominal girth for patients with kidney problems, on dialysis, or with noticeable abdominal distension, ensuring the patient is standing. This measurement must be documented in the progress notes. Hyperactive bowel sounds can indicate obstruction or gastroenteritis. Conversely, hypoactive or absent bowel sounds may be present after surgery, or with peritonitis or paralytic ileus. Checking urine output for frequency, color, and odor is important. Any unusual findings in urine output should be followed up with a focused gastrointestinal and genitourinary assessment. The extremities assessment involves inspecting arms and legs for pain, deformity, edema, pressure areas, and bruises, comparing findings bilaterally. Limitation in range of movement may indicate articular disease or injury. Peripheral circulation assessment focuses on palpating pulses for rate, rhythm, and strength. Check radial pulses for routine assessment and pedal pulses, dorsalis pedis and posterior tibial for peripheral vascular status. Always compare bilaterally. Assess hand grip strength and equality. Unequal hand grip or foot strength may suggest underlying neurological conditions, injury, or post-surgical complications. Check skin integrity and pressure areas, ensuring follow-up and in-depth assessment of mobility and need for regular position changes. Remember, the wound nurse is responsible for wound staging. Inspect all tubes, drains, dressings, and IVs for proper drainage, position, and function. Note the amount, color, and consistency of drainage, and confirm that IV fluids are infusing as prescribed. Assess wounds for large amounts of drainage or purulent drainage, and ensure appropriate wound care is provided as indicated by the patient's condition and orders. Assess mobility, checking if the patient is full or partial weight-bearing, and determining their gait and balance. Assess the patient's risk for falls, documenting and following up on any indications of fall risk, and noting the use of assistive devices. Abnormal findings for skin and oral assessments include asymmetry, lesions, discoloration, dry or cracked lips, hairy tongue, and cyanosis. Musculoskeletal abnormalities include swelling, deformities, atrophy, contractures, and spasms. Clubbing of the fingers is an abnormal finding. An OGRO refers to a slight, constant difference in pupil size, which is usually benign if less than 1 millimeter. Abnormal skin turgor, known as tenting, indicates decreased elasticity and is a sign of dehydration. A visual assessment of urine color can indicate hydration status or the presence of underlying issues. You should check for changes in color during assessment. Abnormal heart sounds include the S3 gallop, suggesting CHF exacerbation, and the S4 gallop, indicating a non-compliant ventricle. Pericardial friction rub suggests pericarditis, and murmurs indicate turbulent blood flow. Identifying abnormal lung sounds is a critical skill. Adventitious sounds such as crackles, wheezes, and raunchy require prompt recognition and reporting. Geriatric syndromes are complex health conditions common in older adults, resulting from the decline of multiple organ systems. Chronic diseases like CHF, dementia, diabetes, and COPD are frequently managed in the lieutenant colonel setting. Common geriatric syndromes include falls, delirium, incontinence, polypharmacy, pressure ulcers, malnutrition, and functional decline. Urgent identification and intervention are key to managing these multifactorial conditions. A focused assessment has a targeted scope and is triggered by an abnormal finding or new symptom. It is time-sensitive and includes specific inspection, palpation, auscultation, and detailed questioning pertinent to the problem. Documentation is your professional defense. You must document every change of condition and support all actions with a clear, skilled assessment. If it wasn't charted, it wasn't done. Protect your license with accurate and timely charting. Remember that an abnormal finding can be a newly discovered condition or a change in severity of a chronic condition. Thank you for viewing this video.